Philippine President Rodrigo Duterte ordered shoot for defeat if people resist. Philippine President Rodrigo Duterte ordered the police and the army to shoot to death in patients with the new coronavirus infection COVID-19 if they resist and threaten the lives of security forces. My order is from police and the army. If there are any problems and if it happens that they oppose and your lives are in danger, shoot for defeat. Death. Is that clear? For death, said Duterte, addressing the nation on local television. Writes, the Philippine president explained that this applies to those who should be in quarantine but do not adhere to it. However, the president's press service immediately announced that Duterte used hyperboles to draw attention to his words. In turn, the head of national police assured that they would not shoot at anyone, and the president in his speech demonstrated the seriousness of his words with regard to public order. Officially, in the Philippines, 96 individuals died from coronavirus, confirmed by more than 2,300 cases of infection. However, statistics may be incomplete due to the insufficient number of tests. Australia begins testing 2 animal coronavirus vaccines. The first test result would appear in June. In Australia, they began testing 2 potential vaccines against coronavirus in a laboratory. It was reported by BBC. The World Health Organization has approved the testing of vaccines produced by Oxford University and the American company Inovio Pharmaceutical. They will be tested on animals. Upon completion of the tests, the National Science Agency of Australia will evaluate whether the vaccines work and whether they are safe for humans. The first coronavirus vaccine was tested last month in the United States. Then scientists immediately began testing in humans, skipping the stage of animal testing. The Australian Organisation for Scientific and Industrial Research says its trials will be in first comprehensive preclinical vaccine test using an animal model. Researchers argue that the speed and the level of the global cooperation that led to this stage was unprecedented. It usually takes up to 2 years to achieve this goal, and they managed to reduce this time to a couple of months. Over the past few days, vaccine samples have been tested on ferrets that are infected with the virus just like humans. About 20 vaccines are being developed against COVID-19. CSIRO is testing 2 vaccine options. The first, developed by Oxford University, is a vector vaccine. It uses a defective virus to introduce the coronavirus protein into the immune system and trigger a reaction. However, proteins cannot multiply, so there is no likelihood of getting sick with this vaccine. Another vaccine from Inovio, it places certain coronavirus proteins in the immune system, awakening the body cell to generate these proteins before the immune system responds. According to scientists, the first result of animal tests are likely to be in June. If successful, vaccines will be referred to clinical trials. To recall back, the outbreak of new coronavirus began in the seafood and animal market in Chinese city of Wuhan. It causes symptoms similar to cold but quickly affects the lung and other organs. The pathogen belongs to a large family of coronaviruses. The disease has already spread to dozens of countries. On the other hand, in Ukraine, the Cabinet of Ministers expanded the list of permitted activities during quarantine and urged pharmacies to work around the clock. On Thursday, April 2, the Cabinet of Ministers expanded the list of economic activities allowed during quarantine, introduced due to the threat of spread of the new coronavirus infection. This was reported on the government portal. During quarantine, the sale of the spare parts for vehicles, in particular for tractors and other agricultural machinery, the sale of daily subsistence poultry, the functioning of all types of financial institutions, in particular pawn shops and credit union, is allowed, the statement said. In addition, the government recommended that businesses help reduce squeeze and congestion of visitors in stores, ensuring the implementation of adopted anti-epidemic measures. In particular, pharmacies work around the clock, admit visitors to the trading floors with expectation of not more than 1 visitor per 10 square meters of space, observing 1.5 meter distance between people, the cabinet emphasized. On March 11, throughout Ukraine, the cabinet proposed the establishment of restrictions on mass events in which 200 or more people are scheduled to participate, but this does not apply to measure of state necessity. Supporting events are possible with the permission of international organizations without spectators. Ukraine also closes borders. The work of the metro as well as road, rail and air services between cities and regions on March 18 in Ukraine would also be temporarily limited. A number of regions closed educational institutions and introduced a number of severe restrictions, from the closure of public catering establishments to the ban on leaving and entering the city. Weeks after this, Cabinet introduced emergency regime throughout Ukraine. Quarantine extended for a month until April 24. In Germany, coronavirus was found in more than 73,000 people. According to the Robert Koch Institute of Infectious Disease in Germany, as of April 2, the number of people infected with the new coronavirus increased to 73,522. 872 people died from the onset of the pandemic in the country. It is reported by Daily News. During the last days in the country, 140 people died. This is slightly less than the day before, when they reported 149 deaths. It is worth noting that another research center, Johns Hopkins University of America, cites 77,981 cases of infection, 931 deaths, and 18,700 cured of coronavirus in Germany from the onset of the epidemic. If we talk about Britain, on the other hand, British doctors are advised to save only patients with coronavirus who have a great chance of survival. Doctors were allowed to disconnect elderly people and those who have chronic diseases from mechanical ventilation. According to new guidelines issued by the British Medical Association, the local doctors will decide for themselves who first of all will need mechanical ventilation devices and who should be disconnected from them. It is reported by The Guardian, severe patients with coronavirus can be disconnected from mechanical ventilation devices to help those who have a greater chance of survival. These instructions appeared on Wednesday amid another sharp increase in deaths in the UK, the report said. These instructions were provided in advance for doctors who have to decide on the allocation of limited resources to save lives when the healthcare system is overloaded with sick people. They prepare for thousands of deaths due to coronavirus daily. The document states that some severe patients may be denied access to treatments such as intensive care or mechanical ventilation. First of all, this can affect the elderly and patients with chronic diseases.